Hey Vet Techs, I'm Justin. On this episode of Elevation, we're going to be talking about basic ECG interpretation. So let's get into a rhythm of reading ECGs. And by the way, these puns may polarize a lot of our viewers, but the next video we post will be by my friend Jesse, and his bundle of jokes will be pretty tacky too. So let's get started, and you'll find out that QRSs aren't really that complex on today's episode of Elevation. Okay, welcome back everybody. So let's get started. My name is Justin. I'm a registered veterinary technician with about 14 years experience on the floor and a VTS in emergency and critical care with my master's in clinical behavior. Today we're going to be talking about ECGs, what they are, how to interpret them, and then we'll briefly go over normal physiology of the electrical system of the heart, including cardiac action potential, electrical conduction, and how to read a normal ECG. And for a little bonus, we're going to look at a Wigger's diagram, and you'll learn what that is later on in the episode. So first, we're going to talk about the heart on a cellular level. Now, this is going to be a brief overview. Don't panic. I just want to quickly highlight a few things. One, all myocardial cells, heart cells, create an electric current. This is important for abnormal ECGs, which we won't get into today, but start to incorporate that into how you think about the heart. Also, sodium and potassium are the main electrolytes that create the current, but calcium is also involved, and in a later video, we'll get into a deep dive about why that is, and some common presentations you'll see on emergency, and how it affects our patients. All cells have a sac that holds them all together, called a membrane. Now, there are proteins in the membrane called sodium-potassium pumps, and potassium pumps. Now, these are constantly pumping in and out sodium and potassium, which creates an electrical gradient where one side of the cell membrane is more positive, the other side of the cell membrane is more negative. We use this term polarized to describe this state. Now, this balance can shift pretty quickly, and that's what creates an electrical current. And this equalization of electrical charge between the inside and outside of the cell is called depolarization. Now again, we won't get into the details in this episode, but in a later episode we'll do a deep dive into what creates an action potential in general, such as a nerve firing, and what makes cardiac action potential so special. But again, all of this heavily involves sodium, potassium, and calcium, which are all ions. Pulling out a little bit from the cellular level, we'll go inside the heart and see what the gross anatomy looks like. And this is a diagram outlining specifically the conduction system of the heart. These are the nerves that run through the heart to make it beat. Now think of these like electrical cords powering the heart muscles. First, in our tour of the conduction system of the heart, we have the sinoatrial node. This is a bundle of nerves that sets the pace for all the other cells in the heart. It connects to the intranodal tract, which innervates the atria. Innervates is a fancy word meaning it makes the atria contract and push blood out of them. Don't worry too much about the internodal tracts. These are side streets on our journey. The second major stop in our tour of the conduction system is the AV node, or atrioventricular node. Now this lies between the right atrium and the right ventricle, as you can see here. The AV node relays our electrical signal to the bundle of His, which branches off into the Purkinje fibers. And the Purkinje fibers innervate the ventricles, making them contract and push blood out. What does this mean for our ECG, and how does it get into our monitoring screen? Well, let's take a look at that now. This is a normal ECG, pristine, not marred by movement, artifact, or arrhythmia. This has lots of different segments used for diagnosing a myriad of different things. But the main points that we're going to look at today are the P wave, QRS complex, and T wave. Okay, this next diagram brings it all together. Now we have two things overlaid here. One is the electrical system of the heart, and just to the right of it, you can see a graph that we see on our screens for our monitoring equipment when we're looking at an ECG. So the top portion, or SA node, if you'll remember, is the first portion of our electrical conduction system. When that fires, the atria depolarize or contract. You see this on the P wave on our ECG. On the picture, this little purple part here at the top of the heart spreads throughout the atria, making them contract until the conduction system comes to the AV node. The AV node fires and relays the electrical signal to the bundle of His, and at this point our QRS complex starts to fire, with its Q happening as the bundle of His conducts the electrical signal through to the Purkinje fibers. Now we have our R wave, and the Purkinje fibers relay that to the rest of the ventricles following the S wave. This is when the ventricles contract, as you can see in the diagram. Now the T wave is the graph's representation of the repolarization of our ventricles. That means all of the cells are now back to being a little bit more positive on one side and a little bit more negative on the other side of the cell membrane. Once everything is repolarized, the whole process starts all over again. Now you may ask, if we can see repolarization of the ventricles on our graph, where's the repolarization of the atria? Well, that's covered up by the QRS complex. We are unable to see it. But if you look where the R wave is on the bottom right of our graph here, you can see the atria are repolarizing with a little red part just at the top of the heart. So let's say that your patient comes in and for whatever reason, they need to be hooked up to the ECGs. You hook them up and their ECG complex looks like this. Ah, geez, what went wrong? What's going on with him? What is this arrhythmia? Well, I told you, we're not going to look at arrhythmias today. This is a trick question. It's actually, you put the leads on upside down. And the point I'd like to make here is that what we're seeing on the graph shows essentially a picture of the electrical discharges of the heart and what direction they're moving in. So if you put the leads on backwards, well, the graph is simply going to be upside down. So how do you put on the ECG leads? The white lead goes on the right foreleg, the black lead goes on the left foreleg, the red lead goes on the left rear leg. Now most hospitals will have a 3-electrode system, but some have up to a 5-electrode system. And if you are one of the few, the green goes on the right rear leg and the brown goes on the center or chest of the patient. So today, I'm going to end with a really cool little diagram here that I could just stare at for hours and imagine what's going on in the body. But I'm a nerd like that. This is called a Wigger's diagram, and this overlays a lot of different things, and they're all happening at once in the cardiovascular system. Here you have volume cross-referenced with pressure over time, and they're overlaid with a phonocardiogram, which is a fancy way of saying heart sounds, an electrocardiogram, which we just talked about, but then we also have ventricular volume, ventricular pressure, atrial pressure, and aortic pressure. Now, don't worry about memorizing this diagram. This is not something I suggest you memorize. I just gave you this diagram to look at, think about what's going on when you have a PQRST happening right in front of you while you're in a clinical setting. Okay, that's about it for the session, folks. That was a quick, down and dirty explanation of what all those squiggly little lines mean on your monitoring equipment. We talked about normal physiology of the heart from the cell to the conduction system and what it looks like on an ECG, what each wave means as it happens in real time. Now you know what normal looks like, so you can better identify what's abnormal. Now on the next video in this series, we're going to delve a little bit more into arrhythmias and abnormal ECGs. We'll talk about the 6 rules of reading ECG and some of the most common arrhythmias that you'll see in hospital. Okay, thanks for watching, guys. I'm Justin for Veterinary Technician Ambassadors, and we'll see you next time on Elevation.